This course covers pros, perio, complications related to implants in the aesthetic zone. When we talk about surgery, we talk about implant position, soft tissue grafting, material selection, and most importantly, the prosthetic aspect that's related to the planning, to the provisionalization. What is the best way to take a shade for implants in the aesthetic zone? When do I use a high-end ceramist versus not? And also the part that is related to the complication. Implants in the aesthetic zone is a very important topic nowadays, especially when it comes to how many components goes into this course. From the surgical aspect to the prosthetic aspects, there is a combination of treatment that goes into place in order to give the patient an aesthetic outcome and a predictable results. Day one is going to be covering in details what are the different criteria that we look at to distinguish whether we go with a delayed versus an immediate approach. And then we're going to focus on biomaterials, on what is the ideal biomaterial that we're going to use, the soft tissue grafting and the implant placement. In addition to the focus, because it's the focus on the delayed approach, we have to focus on the prosthetic component to relate to what is the best way to manage the soft tissue in this case in order to have an ideal emergence profile even when you go with a delayed approach. And then there's going to be a hands-on component related to the delayed approach. In addition to that, we're going to shift gears into immediate implants placed in those sockets and the temporization, in addition to the soft tissue grafting at the time of implant placement and how to manage the palate too. In addition to that, there is going to be a focus on the complication aspect in relation to the implant placement. If a patient presents to you with a complication related whether to your implant, to an implant that you already placed or to an implant that somebody else placed, how do we look at this implant and what is the decision criteria before we decide if we're going to save or remove this implant? Because there is a certain criteria that we look at, and this is going to be basically focusing more on the surgical and the prosthetic aspect, and we're going to go more in depth with the soft tissue techniques that we can cover those recession if they are present, how to do a papilla reconstructions around implants. So we go into a more advanced level day two, and definitely there's going to be a hands-on component on immediate implants and provisionalization, focusing on the different layers of the provisionalization that allows you to respect soft tissue and have longevity in immediate or for implant placement in the aesthetic zone. I'm excited for all of you who are going to join me in this upcoming course. And again, I'll be looking forward to sharing all the info related to the surgical, the pros, and the complication related to implants in the aesthetic zone. And if you need more information about this course, visit thepicosinstitute.com and I'll see you soon.